All right, Tiffany, thanks so much for being on the Friends with Wheels podcast. I appreciate it. My first question that I have for you is tell the audience a little bit about you and how you started, and we can go from there.
Absolutely. Thanks for having me on. I appreciate the opportunity. Yeah, my name is Tiffany Paul. I am a licensed clinical social worker specializing in the treatment of trauma therapy. I work in Oakland, California, in the East Bay of San Francisco. The modalities that I utilize in my private practice today are EMDR and ketamine-assisted psychotherapy. How did I get started? I would say that I got started about 15 years ago as a social worker working in community settings. And over time, started entering the clinical aspect of what it means to be a social worker. Continued to work as a social worker in community settings while integrating the clinical piece. That meant working in community mental health centers, hospitals, and community outpatient settings. Over time, I found my way to private practice, and I now have a thriving private practice in Oakland where I see individuals exclusively for the treatment of trauma using ketamine-assisted EMDR therapy intensives.
Mm-hmm. So tell me a little bit about the work that you do nowadays. What's that all about?
The work that I do nowadays. So the work that I do nowadays is, like I said, trauma-focused therapy, and it is using the modalities of EMDR and the adjunct therapy of ketamine. Most of my clients choose to integrate the two therapies together, which I will go into, but it is not mandatory. Many of folks looking for therapy are looking for only EMDR or only ketamine therapy, and that is available through my practice as well. So I guess I'll start by explaining EMDR. It is sort of the foundation of my practice. EMDR is a structured experiential therapy, meaning that we experience shifts in session together. Um, it is a modality that helps the brain to process experiences that we may have had in the past that have sort of gotten stuck in our nervous system. Um, Memories from childhood or big life events in adulthood that have really informed the way we see ourselves, other people, or the world in a way that hasn't quite integrated into the present. For example, someone might live in a chronic state of anxiety that's rooted in fear that something bad is going to happen, when in fact, they live a very safe life, right? They have what they need, they have a loving community, partnership, family, friends. That sense that there's something wrong or something bad is going to happen is sort of still haunting them. That is an example of something that could be addressed in EMDR therapy. A lot of what we carry from earlier experiences isn't just stored as a story. For example, when I was 10, I got into an accident with my parents in the car and they blamed me for what happened. We can tell that story, but what really matters is how it has been stored in our psyche, right? Our emotions, the beliefs we have about ourselves, the sensations that those emotions bring up. So even if you understand logically that a 10-year-old cannot cause a car accident, and maybe you feel angry that your parents even said anything like that, your body, your nervous system, your underlying beliefs about yourself might still react as if there is something wrong or bad about you, or that things that go wrong are your fault. So in an EMDR session, we start by identifying a specific target or area. This might be a specific memory that you know has impacted you, right? Um, or this could be sort of like a reoccurring emotional experience or pattern that shows up in your life today that you just really want to knock. You're like, I'm sick of, having this some big emotional reaction whenever somebody doesn't pick up the phone, right? I don't want to feel this panic or doubt. It doesn't feel aligned with reality. So we look at what belief is connected to that experience, what emotions are coming up for you when you connect to that experience, and what you notice in your body as you connect to that experience. Folks who know or have heard about EMDR, that there's this association with eye movement because that is the thing that's really sort of strange or different about it that no other therapy um, really uses. Um, the bilateral stimulation is the eye movement piece. And what the bilateral stimulation is doing is while we bring up the distressing memory or the distressing feeling that is bothering you today, we engage the left and the right side of your body. And that can be through eye movements. When EMDR was originally conceptualized, researched, it was through eye movements. So a therapist would say, let's bring up that distressing event, notice the thoughts, the images, the body sensations, and the belief about yourself that comes up when you illuminate that event or that memory. And while you are thinking of that, follow my fingers or follow this light, whatever the therapist may have, and just allow your brain to go wherever it needs to go. And there's sort of a natural pattern trajectory that the brain will take to sort of process what it needs to process. The theory behind that is that when traumatic things happen, they're just overwhelming to our system. So something annoying or difficult or stressful can happen. Like you could have a bad day and if you're able to sleep, you go to sleep, you have good deep sleep. And when we're in deep sleep, if folks might know about REM sleep, right? And during REM
Mm-hmm.
sleep, our eyes are moving back and forth, just
Mm-hmm.
like that. Follow my fingers. And while our eyes are moving back and forth, there is a theory that that is a part of our memory consolidation experience in our brain. That is how our brain, or at least one component of how our brain processes memories, files them away into the past. So if you had a bad day, you stubbed your toe, you were cranky, whatever happened, you were late to work, you go to sleep, you get good sleep, chances are you're going to wake up and feel that day is in the past. It's a new day, right? You'll
Mm-hmm.
probably remember it like, oh, yesterday was the worst. But you won't still feel it in the same way, like you're still in it.
Mm-hmm.
With traumatic memories, really what qualifies as a traumatic memory is that it wasn't fully processed in that way, likely because it was too overwhelming. And especially in a young person, our nervous systems and our brains are easily overwhelmed. We can't quite make sense of things. We don't have the emotional regulation skills. And maybe we didn't have an adult around us who really had those skills either. So we're really prone to getting those sticky memories as a child. Um, so when an event happens that is really overwhelming, or a series of events happens that is really overwhelming or doesn't quite make sense, you're not able to digest it, it gets kind of what we just say is stuck. It kind of hangs out in the present.
Mm-hmm.
It doesn't quite get filed away as a past event. And what that means is that we can go into adulthood, going back to that idea that we could have the most idyllic life where we have all the support, all the resources, and we still feel like something is wrong because that memory is just hanging out. So in EMDR, our goal is to get to the past memory, the root of what has you feeling this way in the present. We have a few ways that we can get there to find where that memory lives. And we activate that bilateral stimulation through eye movements or tapping virtually. If you're looking on video right
Mm-hmm.
now, we use the butterfly hug, tapping left to right on your shoulders. If you're in session with me, I use a tactile device that vibrates left to right in your hands. And some folks even find that their eyes move with the tactile device. There's definitely linkages that are happening in our body, no matter
Mm,
what type of bilateral stimulation you're using. You can also use audio, putting on headphones and having a left to right audio oscillation while your brain is processing
mm-hmm.
the memories, the sensations, the emotions that are tied to the past that we are trying to clear.
Uh-huh. It's yeah, it's pretty interesting, sort of the bilateral stimulation, because I actually interviewed someone on the podcast who is trained in hypnotic therapy, and she explained how like when you sleep, the REM and kind of the brain waves, where it kind of where you go into this pattern of like wave sequences, like alpha, beta, alpha, data, L alpha data, delta theta, or whatever that is. I forget
Yeah,
the
yeah.
pattern, but
Yep.
I remember that. So when you were saying that, I'm like, oh, I know what you're talking about.
Yeah, yeah. And it's funny you bring that up because sometimes I get asked, is EMDR like hypnosis? And it's a good question because it's both are a little bit mysterious, right? So one thing I
Hmm.
say is yes and no. Mostly I see it as a very different therapy. But the main difference, in my sort of overview of what makes these two different in an experiential way in therapy is in EMDR, we are always keeping one foot in the present and we are dipping one foot into the past. And that's that dual attention of awareness coming in and out of the past and checking in with the present is what helps to integrate the past and the present, helps to bring your adult resourced self into the past, sort of witness it with this oftentimes child in the work that I do, and sort of help that inner child, if you will, or that part of yourself that's holding what that child held, catch that child up to the present. So we do sort of go into the past, but I always want to make sure that the person is also rooted in the room with me. And the bilateral stimulation helps with that too, because if someone has their eyes and they're having to move, they have to sort of be here, right? They can't get swept too far away.
Hmm.
And same with the tactile. The tactile buzzers can help the person know I'm here in my body, in this room, in a place that I feel safe enough, that I know I am not in danger. Yeah,
Hmm.
and so that's one of the differences.
Yeah. Because what I was gonna ask is, I know that you use EMDR, but is that the only modality that you used, or do you use other ones interchangeably?
Yeah, I use one primary other modality, which is ketamine-assisted therapy. Ketamine is a tool more than a modality, I would say. And I use it to enhance EMDR. Not everyone who sees me does EMDR, although the vast majority do. Some people choose just to do the ketamine therapy in conjunction with more traditional talk therapy, psychotherapy. I'll start with what that can look like. If someone comes to me and they want to do ketamine assisted therapy, and for whatever reason, they don't want to do EMDR, what that looks like is that first, they have a consultation with me. We make sure it's a good fit. Then I do an intake session with them, continue to screen, make sure it's a good fit. And I send them to my medical provider who does a medical clearance for ketamine. And if they're cleared, they get sent a prescription for a set of ketamine sessions in a bottle, like a pill bottle. Um, they bring that medicine to therapy with me, and then the sequence goes as follows. We have a couple prep sessions where we talk about intentions. Why are we doing this therapy? What do we want to gain from it? What do we want to let go of? What are we ready to outgrow? What, again, patterns, limiting self beliefs, stuck points? Are we wanting to explore or release? What do we want to invite more of? Do we want to invite in more connection, more of a sense of belonging, more peace, ability to rest without feeling guilty, right? We
Mm-hmm.
set our intention based on what the person's where those stuck points are. Again, going back to what is getting in the way, and then we oftentimes in this realm, we might start with more of a future focus rather than going immediately into the trauma processing, thinking about what can we open up? What do we want more of? What do we want to release? And then we move into our journey session, which is maybe the third or fourth session together, depending on how we decide to work. And the journey session is typically 3 to 4 hours long. We set up ourselves in a super comfortable, cozy space in the office that I have here in Oakland. I have a really comfortable couch, pillows, blankets, eye shades, headphones, noise canceling headphones, playlists that go well with guiding the ketamine journey. And we review your intention before you go into the medicine. The client self administers the medicine. I am not a doctor, and so I am not able to prescribe the medicine or administer the medicine. So this is the client and the doctor's um, prerogative. So they bring the medicine the doctor prescribed in, self-administer the medicine, and I am there to be a supportive witness, to hold the space, to help the client hold their intention for why they are here. And then post journey, we do what's called integration, which is looking at what came up for them during the journey. At the dosages that I use in conjunction with my doctor, this is what's called a psychedelic dose of ketamine. It's not quite as high as doses that might be used outside of a therapy session. For example, especially in the Bay Area, there are IV clinics where you go and get an IV of ketamine, which is especially useful for treatment-resistant depression. And it's far, far, far less of a dosage than is used in medical settings. Ketamine is used in medical settings all day, every day as an anesthetic um, in very, very high doses at hospitals that helps people who are in severe pain or who need sort of a cocktail for sedation. So this is a much lower dose than that, but it is high enough to have a psychedelic experience. So what that means when the person is on the couch with their eye shades on, their music playing, they may they slip into sort of a dream-like state.
Mm-hmm.
Most folks experience feeling very relaxed. That chatter in our brains that we all have that says, I've got to do things, I'm not good enough, I have to hurry, whatever it is. All that chatter, trying to analyze ourselves, especially in therapy, we're very good at analyzing, right? And sometimes we want to break from that. The ketamine quiets all of that and helps us to witness ourselves without all of the narrative, without all of the judgment, without all of that extra chatter. Um, and when we are able to connect with ourselves in that way, I find folks experience a lot of self-compassion, a sense of I'm a human on this planet, just like everybody else. Um, Folks might have uh, visuals pop up that are a lot of folks experience something like feeling connected to the universe as a whole, feeling connected to nature. And this can be a really healing experience for someone who feels chronically disconnected or just chronically overwhelmed by rumination or self doubt. So this is an example of some of the themes, one of or two of the themes that I see in journeys, although everybody's journey is different. Some people do have thoughts or memories about traumatic material come up or grief come up. And what's really interesting about that experience is it's often not scary.
Mm,
So, where it might feel really scary to, for example, go into EMDR and revisit something awful that happened, when there's ketamine on board, there's a little bit of distance. So, we're able to notice, wow, I can see what happened to me. And I feel so sad for myself that that happened. And I
mm,
can notice that I feel sad and I can cry. And that feels right to cry, right?
mm,
And I can handle that. And
mhm,
I'm just going to let myself be here. So sometimes in ketamine, using ketamine, it really allows, it takes down sometimes the barriers that our functional selves put up to say, I can't go there because I'll be too overwhelmed. I'll be flooded. I'll have a panic attack. Ketamine provides a spaciousness where folks are often able to see things from a different perspective with less emotional charge. Even when the emotion is there, it feels okay. It
mhm,
feels handleable. And that's actually a good segue into the second way I use ketamine. So the first way is the psychedelic dosing, where we do prep, journey, integration. The second way I use ketamine in my practice is at an even lower dose, using a low dose of ketamine, which is called a psycholytic dose, not psychedelic. We're not having any sort of visions or feelings of not, being disconnected from like our present. We are very, very present. Um, but that very low dose helps us to open up our brain a little bit more and to
mm,
lower those defenses a little bit, to soften it a little bit. So that when we are doing the EMDR process of accessing traumatic memories, it's more accessible, it's a little more gentle. We don't get as stuck, and we're able to process a little bit more fluidly without feeling as overwhelmed. So, this is a good adjunct for someone who might fear that they get very overwhelmed. It really helps to sort of tamp that down.
mhm. So if I could ask this next question, like, what have you, what have you learned in doing this kind of work? Like, is there anything that you sort of take away from working with patients?
Yeah. Yeah, I would say one of the biggest things I've learned in this process is that a lot of folks come in actually having an idea of the story. Like they know many people have done therapy, talk therapy, which I find valuable. Um, they've gained a lot of insight, right? They've started to understand why they are the way they are, right? Um, And some folks come in here and they can just lay it straight out. I have these symptoms, I have this trigger, this thing helps, this thing doesn't help. I have coping skills that work most of the time. And I pretty much have a good idea of why the things that trigger me trigger me. Um, and oftentimes, folks have figured that out through therapy over the years. And then they get to a point where mitigating my triggers, I can utilize my coping skills, and they are helpful. I really want to get to the root of processing the thing that happened so I'm not triggered to begin with. So for me, the thing that I've learned in my course of developing as a therapist is that it is really an honor and a privilege, both as a therapist and a patient, a client, to be able to have space to go to the root. And that is also why I offer longer sessions. I don't actually work in a traditional therapy model. I don't do the 50-minute weekly therapy sessions. What I do instead are 2 to 4 hour sessions, at least once a week, sometimes more than once a week, depending on the treatment plan, the client's availability, the client's resources. We want to get in to this. And I find that doing this depth work, going to the root, it's not actually ethical in my experience or effective to try to do that in a 50-minute session. So I have these longer sessions, something I also learned along the way, so that we can set the stage, prep the work, get grounded, really go into some difficult material, and then come out the other side together and reorient, reground, and prepare to re-emerge into the world. So this is not a lunch break therapy modality, right?
Mm-hmm.
So I've learned that these are the modalities that help to get to the core. And I just really value that. I've also learned that longer sessions, working more intensively, is much more effective when someone has the resources to do so, meaning that they have a safe place to go home to, right? So that they can go home and continue to process this without massive stress coming at them. They have a certain amount of stability in their day-to-day lives, and they can take the time to do this for themselves. It is something that not everyone has the access to do, unfortunately, right now, um, just because of the way our society is structured. Um, so I try to make this therapy as accessible as possible in that way. I work with people, their schedules, um, and just make sure that we build a customized treatment plan for each individual because everyone has a different set of needs.
Mm-hmm. Like, was there some sort of a mentor that you looked up to that made you want to become a mental health professional?
Hmm. I think that I wanted to become a mental health professional by learning from my clients in social work, social services. I saw the suffering that people were experiencing, and I really just came to know that so much of the suffering that folks are experiencing, the folks that need social services, there's just so much trauma wrapped up in
Mm-hmm.
this, in the experience of growing up in poverty, in the experience of disability or medical trauma, in the experience of, growing up in certain systems, in certain environments. And I just saw trauma everywhere, right? Um, People who don't have their needs met. Um, And what I see in a lot of the adults that come to my practice now is these are folks that grew up in really rough circumstances, and they have mustered their way out somehow, right? They have managed to build a fairly stable life, and that trauma remains, right? So these are folks who are walking around looking like they're doing great. And what we know, sometimes when we are suffering as individuals, we think other people aren't, right? Like, or, oh,
Mm-hmm.
I'm broken, right? I have trauma. What's wrong with me? I can't seem to be happy, even though my life is great. Um, and what I've learned also as a therapist is that is not true at all. We all have our stuff that we are carrying around, often masked or silent, right? And so, um, yeah, I would say honestly, the people I learned the most from all along the way were my clients. Um, and then also, so that was really the inspiration that guided me towards this work. And then learning from other therapists who were already doing this work, who provided maybe trainings or consultations, or just peers of mine who were doing similar work, really inspired me to know that it was possible, um, that it was possible to have a practice that actually supported healing and that was sustainable for myself as a working professional.
Hmm. And lastly, what tips or advice would you give to those who want to do what you're doing, who want to get into the mental health field, who want to be just
Mm,
like you?
oh my goodness. Well, actually, going off your last question, I think one of the first things to do is to connect with people that are doing the work. Um, Whether it's on Instagram, right, or people you might know, or email me, um, ask me questions, DM me. I think reaching out, especially when you're just in the early stages of trying to find a career path, is really, really important. For folks that might already be on the road to becoming a therapist, for example, maybe they're in a social work or marriage and family therapist or other therapist training program right now, my advice is also to connect with other therapists. I think we need each other's support, and we're all figuring this out together. Um, get consultation, reach out to therapists that you would like to be one day. I myself provide consultation both for pre-licensed clinicians and clinicians that are EMDR providers that are curious about adding ketamine-assisted therapy to their practice. So if there's something that feels intimidating, right, that there's a new modality or a new way of operating, doing intensives, working in these longer sessions, I found my way to how to do this by clues from my clients, but also in a functional manner from other therapists who figured it out first. So don't be shy to reach out, to connect, and find community.
Hmm. And for people who want to find out more information about what you do or how to sign up for a consultation, what can they do?
Absolutely. You can find me. Google is a really easy way to remember. You can type in Tiffany Paul, therapist, Oakland, California, and I will come up. My website is tiffanypaulpsychotherapy.com, and there is tabs on there that explain the modalities I do, how I work, as well as how you can book a consultation for potential therapy if you want to do therapy with me, or if you want to book a consultation with me as a therapist who wants to learn more about how to do this. You can also find me on social media at EMDR with Tiffany.
Hmm. Yeah, or on Psychology Today, because I hear that everybody, it's a great resource.
It really is. It's a great resource. Psychology Today is the predominant directory online. So even if you Google my name, you'll probably find my Psychology Today profile, right? Maybe even before my website. So Psychology Today is a great place to start if you are looking for a therapist in your area. The thing I like about it is that there's filters. So most therapists are
Hmm.
on Psychology Today, and you can filter for your zip code, your city. You can filter for gender. You can filter for insurance. This is especially good for folks that are wanting to use insurance because a lot of therapists are not on insurance panels. If you need to use insurance, I do recommend going to Psychology Today and filtering for your insurance and your area. If you know what kind of modalities you want to work with, for example, if EMDR is attractive to you or ketamine-assisted therapy is attractive to you, you can also filter from modalities.
Hmm. Okay. All righty. Okay.